shiny head reveals him. His note is made of wood, and although he may not be real, his heart is made of gold. His heart is made of gold. His father did create him, meticulously so, and as real as he intended, Pinocchio was born. Pinocchio was born. He was born with a bolt and a twist and a shiny coat of paint and a hefty imagination. A boy was made that day. A boy was made that day. Father, am I a real boy? Geppetto quickly responded, as real as you can be. Son, you're real to me.
That such word has led to believe that there is definitely a sexual orientation or a sexual issue or problem to begin with because of the word transsexual. What I believe that he meant to do was to explain that trans meaning to cross over to the other side. To me, I would rather use the word transgender because it is a crossing to the other gender without implying the sexual orientation part, because it really, transgenderism has nothing to do with sexual orientation. These are two separate issues. Sexual orientation is what you like, what you're attracted to. Gender identity is what you identify with, whether it's your own gender or not your gender. Like that, and I think that as we progress and as we develop in this world, and technology and education such as what you're doing with this documentary, hopefully it will enlighten some people regarding sex and sexuality, that it doesn't have to be this sick, perverted, disgusting, horrible thing, that is a part of our natural being. It's part of who we are. Our sexuality is one aspect of what we are. It's not what we are. But you're right. When it comes to sex and sexuality, there's taboos, there's dirty, there's religious, there's a sinful thing. Even the politics become involved. You would say that your sex and your sexuality is something private, but it really isn't. Everybody needs to know what you're doing, when in reality it shouldn't be like that. And I think this is why people have such issues, because if there happens to be a problem, or if there happens to be something that they're not happy with their own sexuality, they don't have anyone to talk to about it because of the big taboo.
Who are you to say that we're not equal? Who are you to say we're not the same? Is my love not true? Are my emotions not worthy of a marriage this day and age? How did you take over an institution?
National Guidelines for Gender Dysphoria. Basically, he states that when a patient comes to you with gender issues, one, as a therapist, as a clinical sexologist, should evaluate the validity behind their presenting problem. I have had cases so far. I'm very fortunate, I guess, that all of my patients have been truly gender identity dysphoria or disorder patients. However, there are some people that may want to do this, and I'm not saying this is the case of the majority, but just like with everything else, there may be some people that may want to do this for other reasons. So one, as a therapist, needs to abide and needs to make sure, even for the safety of that patient, to make sure, is this really what you want to do? If this really what it's all about, and assess the severity, assess the need, again, for the safety of the patient, and then proceed with the recommendation. I particularly go back to an endocrinologist for the hormone treatment, and then eventually, even when, to do the sex reassignment surgery, which is the last step, and not everybody does it, so let's not even get into that for now. But basically, what the Harry Benjamin states is that as a therapist, you should assess the validity behind the presenting complaint, the presenting problem. Then have them be in the hormone treatment for about a year or so, and then have the individual live as the other gender full time, even for their own safety, to make sure that they're okay with this new role, and also for the acceptance of at least the loved ones around this individual. We'll never get to have full acceptance by the entire society, which is one of the main issues that we have, Mark. But at least for this person to feel safe and to feel comfortable enough as the other gender. About the DSM, I really hope that it gets removed, because I, like you, do not believe it's a psychological issue. I think it's a biological issue. It's a mistake from nature. Something went wrong. And perhaps the reason why it has remained in the DSM, it's because of all the problems that it may bring about, but not because you are transgender, but because everything that you have to go through. Just what happened with homosexuality. Homosexuality was removed in 1973, thank God, because it was no longer considered a pathology. But they realized that being gay does bring about a lot of issues, just like being depressed, just like getting a divorce, just like losing a child. But it's not a pathology in of itself. So I do agree, and I do hope that it gets removed so that people can depathologize this condition and treat it as what it is. Is a fault of nature.
People say I'm crazy, they don't understand the kind of life I lead trying to be a man. The ups and downs I've gone through trying to build my world. It hasn't been that easy, not at all. You don't know how it feels inside. You don't know how much I have cried. Transgender man.
Gender identity. The fact that your gender, which is your brain, and your physical sex match. It's not something we actually ever think about. We take it for granted. If your birth certificate says male, you have male parts, then you're a male. Or vice versa. If your birth certificate says you're a female, you feel like a female, and you have female parts. However, 1 out of 100 babies are born with some form of gender identity anomaly.
My mother was given hormones to try to get pregnant, and she was also on thyroid medication since she was 8 years old. One of the things that I'm teaching my crusade is that although you think transsexuality is 1 in a million, this issue is going to be everyone's issue in the future to come. Everything that we eat today has hormones. Everything around us is full of toxins, pesticides, herbicides, fungicides, estrogenic compounds found in soy products that you eat day in and day out. Then your mother's uteral environment changes, and this goes through the placenta inside the child's brain, and this is how you get this gender and physical sex mixed up. And that's how you get hormones that are not communicating the way they're supposed to, and the byproduct is an individual like me.
Destined to suffer so. Do you see what I see? Can you feel what I need? I am that road less traveled. You try to forget it, that God's been so cruel, that your brain and body don't match like it should. Oh, little